We're doing this little video for the benefit of those who have taken my M1 course, and one of the first things we do is the long restrictors of the hip. And when you are rehabbing a hip or working on a hip or a pelvis, after you clear these long restrictors of the hip, sometimes it's necessary to re-educate the muscles. Now, if it's a sagittal plane muscle like a hip flexor or a glute, those just take their time getting rehab just by walking and doing normal daily living things. But rotation is a different thing. So if you've got a population of people who are maybe runners and you've done this nice clearing of these rotators in the hip, you're going to have to re-educate the muscle when you're done. And this will make a huge difference in the person's progress, because they're not going to come back after 2 miles and say, it started bothering me in the hip again, if you'll do this. So after you clear your long restrictors of your hip, and in particular your rotators, okay, then you do this. I want to get these to start working again, so I'm going to pull her all the way over, and I'm going to tap her on the ankle and say, pull it across your body. There you go. And great, and release it. And pull again, and pull, 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 and release it. And pull, pull, pull. And each time I give her a little more resistance, and I want to go full range to full range. So full, release it and let her go. And pull, pull, pull. And I'll do this about 10 times. And then I'd say push back towards me. And so she push, 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 and make her push all the way to the end. And I'm giving her a little stabilization down here. All the way to the end. And push, 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 push. Now, if you notice, she's bringing her leg out to the side. We don't want that. We want to keep it right here. So push toward me. Push, 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 push. There we go. I was probably giving her too much resistance. There you go. All the way out, all the way through it, all the way through it like this. And again, go about 10 times. Push, 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 push. If you've got somebody who has trouble pushing, what you could say to them is, don't let me move you, and I push on her and she doesn't let me move. She holds me solid, she doesn't let me move. And that all of a sudden teaches her how to use those muscles. And of course you can do it on this side. Don't let me pull your leg, and she fights me there. And that may be how you can facilitate movement when people have forgotten. So when do you do this? After you've cleared the long restrictors of the hip, especially the rotators, as I teach in my M1 class, and you do this little extra thing to help facilitate those rotation muscles. This way, when they go for a run, they're not going to get that feeling like somebody shot them in the butt with an arrow or stabbed them with a knife.